Minnesotans only have a few days now to sign up for insurance through MNsure to make sure they're covered at the beginning of January. More than 90,000 people could see premiums and higher premiums, and MNsure says about 19,000 could lose all financial help unless Congress acts. Callan Gray spoke with organizations helping people navigate the insurance market about what they're seeing right now.
Kevin, right now, dozens of MNsure navigators are working across the state to help Minnesotans figure out what plans they can afford with that deadline looming. We spoke with two of them who tell us they're hearing from people unsure of how they're going to pay for services if subsidies aren't extended.
MNsure says it's fielding a high volume of calls, telling us it's taking about 1,000 more each day than this time last year as Minnesotans work to navigate an uncertain health insurance market. Certified navigators,
it's very frustrating,
counseling people with fewer options as the stalemate in Washington over Affordable Care Act subsidies continues.
It's very, very difficult to be the bearers of the message that there may not be affordable options.
Stephanie Radke is president of Portico HealthNet, which helps thousands of people enroll in insurance each year, starting with an initial intake.
What we're finding is for a lot of people looking into qualified health plans that no longer have the subsidies, only about half of the people are calling us back and moving forward through the full process to get insured.
They're encouraging people who haven't signed up to reach out for help, a message other navigator organizations are echoing.
I think it's important for people to understand they still have agency.
Kimberly Spates is CEO of North Point Health and Wellness.
I think it's going to be important for folks to really think about what can I actually afford, right? And try to prioritize the things that are most important to them and their families.
As a federally qualified health system, she says they offer discounted care and can be an option to people who can no longer afford their old plan. Right now, she says about 26% of the patients they serve are underinsured or uninsured. They expect that will rise to 30 to 40%.
We're doing our best right now to educate individuals about, the changes that are coming, but also to let people know we're still here, we're still open and available.
Spates explained with demand expected to go up, they're working to expand capacity and open up more appointments, including at their 2 satellite locations, Kevin.
Okay, that's Callan Gray.